This is the country that lives very much in the present, and there's a reason why a fiesta is one of the best known words in the Spanish language. It's because life itself here is a fiesta and everybody seems to be invited. It is considered to be one of the most peaceful place, but suddenly things turned bad out here and a tragic incident happened which can never be forgotten. In 2019-20 coronavirus pandemic was confirmed to have spread to Spain on January 31, 2020, when the German tourist tested positive for SARS in La Gomera, Canary Islands. By 24th of February, following a coronavirus outbreak in Italy, Spain confirmed multiple cases related to the Italian clusters, originating from a medical doctor from Lombardy, Italy, who was on holiday in Spain. Afterwards, multiple COVID-19 cases were detected in Spain involving people who had come in contact with the doctor. On Saturday, 7th of March, 24 hours before hundreds of thousands of people rallied across Spain to mark International Women's Day, and 9,000 faithful Vox supporters arrived in Madrid for a far-right jamboree, authorities in the northern region of La Rioja were taking some difficult decisions. 18 days later, Spain has confirmed 47,610 cases, and, with a death toll of 3,434, has logged more fatalities than China. Similar measures soon followed elsewhere, and, on the evening of 12th of March, the Catalan government ordered about 70,000 people in 4 municipalities in the Barcelona region to remain in their homes for 2 weeks after a steep increase in cases in the area. On 1 April 2020, there have been 102,179 confirmed cases with 22,647 recoveries and 9,131 deaths in Spain according to authorities. The actual number of people infected, however, is likely to be much higher than the number of confirmed cases, as many people with only mild or no symptoms are unlikely to have been tested. A study by Carlos III Health Institute found that some communities had only been able to identify half of their coronavirus deaths, while others had managed to eliminate this problem after March 16. At least 5,231 hospitalized people are in intensive care. As of 21st of March, 350,000 tests for COVID-19 had been distributed. Since March 13, 2020, there have been registered cases in all 50 provinces of the country. As of late March, the Madrid region has recorded the most cases and deaths in the country. Medical professionals and those who live in retirement homes have experienced especially high infection rates. It is one of the darkest and most dramatic moments in recent Spanish history. In the chilling table of daily dead from the coronavirus pandemic, Spain has taken top position from Italy, with 738 dying over 24 hours. Spain is now the hotspot of the global pandemic, a ghoulish title that has been passed from country to country over 4 months, starting in Wuhan, China, and traveling via Iran and Italy. As it moves west, we do not know who will be next. This may, in fact, be one of the reasons for the country's late response. Spain thought it was far enough away. Spain will only have a handful of cases, said Dr. Fernando Simon, the head of medical emergencies in Madrid, on 9th of February. 6 weeks later he gives out daily figures of hundreds of deaths. The number of dead per capita is already 3 times that of Iran, and 40 times higher than China. The Spanish government is facing growing criticism for its response to the coronavirus pandemic after the disastrous purchase of more than 500,000 testing kits from China. Following weeks of severe shortages of health equipment required to cope with the virus, the government announced the purchase of 640,000 Chinese-made testing kits, which would help the country speed up diagnosis of the disease. Spain is also bracing for a shortage of beds in intensive care, the anti-malaria drug that has been given to coronavirus patients. The majority of producers of this drug are based in India, which has recently banned exports to guarantee its own supply. A senior official within the Ministry of Foreign Affairs insisted Friday that the government's response has not been slower than other European countries, adding that it was not until March 9 that the World Health Organization recommended cancelling all mass events in countries with community transmission of the virus. The decision to declare a state of alarm and the country's lockdown were taken when the number of confirmed cases hit 4,000 and the death toll reached 120 earlier than in countries such as France. The data shows 898,822 people have lost their jobs since the start of the lockdown, including about 550,000 temporary workers. Spain's official unemployment figure rose to 3 million, the highest level since April 2017. This is an absolutely unprecedented situation, Labor Minister Yolanda Diaz told a news conference. The tourism and construction sectors were the hardest hit. As of 28 March, at least 9,444 of the cases, about 14% of the total, double that of Italy, are in healthcare workers. One cause of infection is the lack of adequate protective gear, leading some healthcare workers to make their own improvised gear. According to Fernando Simon, only 8% of diagnosed healthcare workers require hospitalization, in contrast to 40% of other cases of the disease. Some doctors and nurses have nevertheless succumbed to the illness. Many nursing homes in Spain are understaffed because they are for-profit businesses and elderly Spaniards cannot necessarily afford sufficient care. In some nursing homes, elderly victims were found abandoned in their beds by Spanish soldiers mounting emergency response. Defense Minister Margarita Robles said that anyone guilty of neglect will be prosecuted. If you want more videos, then click on the subscribe button and push the bell icon so you can never miss any video.